So probably the most important reason to have a primary care provider is there are multiple conditions that don't really arise with symptoms. So people generally say, well, I'm feeling good, why would I go to the doctor? But there are some things like blood pressure, cholesterol problems, some cancer screening that we want to identify problems long before symptoms occur, because once symptoms occur, sometimes you can't reverse the problem, or it's a much more dangerous or involved procedure. So having some routine care over time is valuable, just to try and prevent issues, find things before they become a problem. Once they become a problem, sometimes that's too late. It's also important to have someone that you know and that you see routinely, so that they know what your normal is, and then when a problem arises, it's a little bit easier for them to figure you out. They know how healthy you are, kind of what your communication style is, what types of things maybe exist in your family history, and there again they can tailor their approach to figuring out problems a little bit easier than someone that's meeting you for the first time or meeting you in the ER. And so having that relationship and that person that you've known over time can improve your medical care when you need it.
Having a primary care provider is very important. There's multiple things that we do for patients. One is that we screen for lots of different medical conditions, and so things that if we catch early, we're able to head off and treat and reducing complications and issues down the road. The other thing is we manage chronic conditions as well, which is also very important. There's also been evidence that shows that they save a lot of money in healthcare costs over their lifetime. So people that have a primary care provider and see them regularly actually save up to 33% in their healthcare costs over their lifetime, compared to people who see only specialists or people who don't have a primary care provider at all. So I think that's something to keep in mind as well.
I've seen a lot of patients here that don't have primary care providers, and typically a lot of patients just come in for acute urgent care issues, but I think it's not more important, but it's equally as important to have some type of preventative care and be followed by a primary care provider, so that they can check your labs, check for any screening, and do the preventative stuff to kind of keep you healthy and keep you from becoming unhealthy, whether it's heart problems, diabetes, or whatnot. I think it's important.